I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and this is a made-up case of a 29-year-old female who was diagnosed with ductal carcinoma in situ. She felt an area in the upper outer quadrant of her left breast that just seemed prominent to her. Not a distinct mass, no skin changes, no pain in the area, and no nipple discharge, but every time she did a self-breast exam, her hand just kept coming back to that same spot, which was different from the upper outer quadrant on the other side. She went to see her PCP, who agreed that it felt a little different, but she wasn't sure what it was, and the PCP went ahead and ordered a breast ultrasound for her because the imaging facility said that she was too young to have a mammogram. She had a breast ultrasound that was totally normal, but she and her primary care doctor weren't satisfied with that, and then her primary care doctor ordered this MRI. And this is what her MRI showed. This is what we call non-mass enhancement, and you can see that it comprises a pretty large portion of her breast. All the other patchy gray stuff you see is background enhancement, which is really common when you do an MRI of someone in their 20s. Because of this MRI, she was able to get a mammogram, which showed some calcifications, and she underwent a biopsy, which demonstrated ductal carcinoma in situ, grade 3, estrogen and progesterone receptor negative. She had genetic testing done, and she was found to be BRCA1 positive, which is consistent with her family history because her grandmother's sister was diagnosed with breast cancer at the age of 30. And her grandmother passed away at the age of 50 from a heart attack, likely before she developed any type of breast cancer, ovarian cancer, or pancreatic cancer. The patient elected to do a bilateral mastectomy or remove both breasts, and 5 years later, she's doing very well. The PSA is, if you feel like there's something wrong with your breasts and you have a gut feeling about it, it could just be that one side of the breast feels asymmetric compared to the other. Please get it checked out and find a primary care doctor who will hear you. And if you can't find a primary care doctor who will hear you, it's okay to see a breast specialist or see a high-risk breast clinic, because we will always take breast concerns seriously.